are some new recommendations for doctors on how to treat patients with type 2 diabetes. The American College of Physicians released the recommendations just within the past hour.
And our doctor on call, Zorba Pastor, joins us from his clinic in Oregon, and it really changes the blood sugar level slightly higher, right, Zorba?
Absolutely. And it's very interesting because for years we've been saying, get that blood sugar down, get that blood sugar down, get it down. And then some studies came out that showed that maybe too low a blood sugar isn't good because you run a risk of hypoglycemia, low blood sugar, maybe a risk of stroke from that, risk of falling because all of a sudden you get dizzy and all the issues involved. So a number of studies recently have come out looking at that. And the American College of Physicians, publishing in the Annals of Internal Medicine, looked at all of these studies and said, wait a minute, guys, we're doing blood sugar, we're treating it too low, we're being too aggressive, and that particular number called the hemoglobin A1C shouldn't be close to 6, it should be somewhere between 7 and 8. Well, enter the American Diabetes Association that said, wait a minute, we don't agree with you, and right now they're kind of fighting it out, but I'm with the American College of Physicians. I think our numbers have been too low for a long time, and basically we are spending too much time giving patients too much medication. Now, if you're a diabetic, don't stop taking your medication by any means, but you should talk to your doctor about this new study because you may need to be on less medicine versus more medicine.
Very interesting. All right, let's go to the phones, and our first caller actually has a diabetes question. Let's go to Jeannie in Montello. Hi, Jeannie.
Hi.
Go ahead.
Yes, Dr. Zorba. I watched your show about a week ago or something, and you were talking about diabetes and how their stomachs get big and that there is something they can take to help get that down. And I forgot to write it down. Could you tell me what it is?
It's called diabetic gastroparesis. Big word, and it basically means a stomach that does not empty properly. And there's a drug called Reglan, R-E-G-L-A-N. That's the name brand. It is a generic drug. And taking that 2 to 3 times a day on an intermittent basis can help with the bloating associated with diabetes. Talk to your doctor about it. It's a reasonable medication to take, and it might help you.
All right, Reglan.
Reglan.
Something to remember.
Reglan, R-E-G-L-A-N.
All right, Zorba, thanks. Let's go to Terry in Madison talking about neuropathy pain. Terry, go ahead.
Hi, yeah. I hope this qualifies as one that you could answer. I don't have diabetes, but I have peripheral neuropathy, and there's a lot of pain, and I've just been dealing with it for a couple of years. Is there something you can tell me that would relieve that pain at night? Because it takes me like about an hour or so to go to sleep.
Oh, sure. There are a couple of things. First of all, the most common peripheral neuropathy is from diabetes. B12 it can also do a peripheral neuropathy. There are about 20 or 30 things that can do it, but also there's something called idiopathic peripheral neuropathy, which means we don't know what it exactly it is. But the treatment is often a drug called gabapentin or Lyrica in a high enough dose. Gabapentin is a generic 300 to 600 milligrams, even up to 800 milligrams, can help a lot of people with peripheral neuropathy. I think I talked to your doctor about that. That can be very useful.
All right, very good. Thank you for calling. Let's go to Ann in Oxford. Hi, Ann. What's your question?
Hi. I have a question. On my right foot, next to my big toe, I have that toe next to the big toe. There is a nail there that's smaller than the other nail on my right foot. It's gotten considerably smaller. And I was wondering what caused that. And there's no pain or anything with it. I can wiggle my toes. I can walk just fine.
Sure.
But I was wondering what would have caused something like that.
Well, first of all, if you're unsure, next time you see your doctor, take off your shoes, have your doctor look at that nail. Sometimes trauma can cause it, just bumping the nail, even if it happened years before. Fungal infections under the nail can cause it. And sometimes our feet just change. As they get older, our feet change. They get a little bit more crowded, and sometimes the nail actually will simply change because of age. Those are the things.
So pretty normal.
As long as you don't have pain, that's the issue.
Okay.
Pretty normal.
Very good.
All right, let's go to line 4. Sue is in Madison. Sue, go ahead. What's your question for Dr. Zorba?
Hi, I was calling with a question about stomach or GI issues, and I didn't know if they're all related, like acid reflux, constipation, and if I should try a probiotic for all of that.
Sure, probiotics can make a big, big difference. Best probiotic is yogurt. As long as yogurt has active culture, that's your cheapest, most inexpensive probiotic, as long as you can actually tolerate it. You can get over-the-counter probiotics too if you're milk intolerant, but I always think yogurt is the best way to do it. It's sort of the traditional probiotic.
Okay.
All right, very good. Let's try to get one more call in. We'll go to Mary in Madison. Hi, Mary. What's your question?
I have been a type 2 diabetic for years. I lost 105 pounds.
Wow.
Is there a chance that my diabetes is getting better? Because last night I didn't even take a pill.
Mary, good for you.
Good for you. Wonderful thing that you did. Talk to your doctor. Often it means you can reduce or stop all of your medications if you lose that much weight. Keep it up. Lifestyle is the best treatment for diabetes there is. If it works, check with your doctor. Do your labs. That's the answer.
All right. Well, thank you for your calls, everybody. We're out of time this afternoon. But Zorba, great to see you. We'll see you next time.
Great to see you guys.
Thanks, Zorba.
Take care.
Thanks so much. We'll be right back after a quick break.